Now, madam?
Yeah, now changing it.
Yeah, okay. Thank you. So,
Now it's changed. Yeah.
yeah, compared to adult, children will be having dosha dusha mala, but in a smaller quantity. So, according to that, our whatever treatment we are prescribing, that is in a smaller quantity. Okay, so one more, that is whatever medicines you are prescribing, that should be palatable form for a child, because adult will be taking medicine kasha anything, but children's are not taking. So we should give along with the sugar, jaggery, honey, grita, milk, etc. should be given as a anupana for a child. And like pramanam anyat, as we know, pramana means the dose should be in a lesser quantity. Upakrama anyat, the treatment modality should be changed in a child, as like a panchakarma, shodhana karmas are indicated in adult but contraindicated in children. But still sometimes some diseases will be indicated. For example, in case of kukunaka roga and bala shosha, in that condition the main cause is kapha dushita stanya leads to Shota Avarodha leads to disease. So in that condition, still we need to go for Vamana, and we are advising Vamana. But classically, we are not going. You just take a Madanaphala Pushpa and you just make it a paste and apply over like a nipple of the mother and leave for 1 yama. After that, you just remove the little quantity will be present over that like a nipple. Then advice for a feeding. That little amount will be goes to child through feeding, then child will be vomit. So some treatment modality will be changed like compared to adult. If child is indicated virechana, then for example in case of pandu kamala, in all twak vikaras, here in adult we are giving virechana and all, but in children sadhya virechana can give, like with like madana phala, like sorry, madifala rasayana, and some granules. Leha can also give with the rechaka dravyas can give in a lesser quantity. Okay, then comes to basti. Basti is always indicated after 1 year. You need to start a matra basti or yoga basti also give after 5 to 6 years. So basti also we can give after 1 year. If child is indicated rakta mokshana, so that is also contraindicated, as these children will be apakwa dhatu. That's why we can replace rakta mokshana like as a jalav kavacharana. Okay, nasya is indicated from birth to like up to geriatric stage. You can go for a navana nasya. This is the treatment modality for child. Okay, let me start with some success stories. So this is Shwitra. In Ayurveda, all the skin diseases will be comes under Kushta Roga. So in Shwitra is one among them. Here, 7 Saptadhatus are involved, like a Tridosha, Rasa, Rakta, Mamsa, Meda. Mainly here there is an impairment of Brajaka Pitta. Brajaka Pitta, it is a main responsible for a complexion of skin. So that is the impairment in this case. This is a three like a 9-year-old child. Since 3 year child is having hypopigmented. It is a main cause is deficiency of melanocyte leads to hypopigmented patches over the skin. Sometimes like vitiligo, it is a chronic non-contagious disease, and it will be autoimmune from hereditary or due to impairment of metabolism leads to vitiligo. So 9-year child, since 3 year child is having hypopigmented, I have started some shamanaushadis like tablet pigmento and pigmento ointment. It contains like bakuchi, and in pigmento ointment I have added tamra 2.5 gram, and that applied advised to apply local application, and along with that Arogyavardhini Vatti 1 tablet BD. Manibhadra Guda, it contains Trivrutta, so which will helps to for a like a virechana, half teaspoon night time, with the hot milk or hot water twice in a week, and soamla compound which is need to matlab increase like immunity power in the child. So these medicines I have prescribed for 2 months, and when they came to the for follow up with the some like blackish patches, and you can see just over forehead after treatment, small patches come down and they turns to blackish discoloration, and other pictures small black dots are coming. This is only for 2 month treatment child. Still child is taking under treatment only. In second visit, when they came to me, I started Mahamanjistadi Kashaya 7 ml with equal quantity of water before food, and Kadiralsta 5 ml with equal quantity of water after food, along with pigmento tablet, pigmento ointment with Tamravesma, and Manibhadra Guda. So within a 2 month, we will get a little bit improvement. And this is one more. So here only 1 month treatment I have done. This is 15-year-old girl, like a whitish patches were present at lower extremities. After 1 month, she has sent me pictures by marking small dots are like coming. For her I have advised same, only the little bit dose I have increased. Along with Arogyavardhina Vati, I have added Gandhaka Rasayana and Mahamanjistadi Kashaya. This should be advised for 45 days, and when second add Kofal immunity tablet, one tablet BD, and Bakuchi Taila local application, along with the pigmento tablet and pigmento ointment. Within a 1 month, she has started black dots over skin, because she's suffering since 9 years. So now she's very happy, but both are under treatment only. Hello, is it I'm audible?
Yeah,
Yes, ma'am.
it's
Yes,
audible,
ma'am.
madam. You
Yeah.
You're
continue
audible.
it.
Yeah. So one more, that is Tamaka Shwasa. So in seasonal we will get many cases of Tamaka Shwasa, because previously they went with like allopathic doctors. They used to take antibiotics and they will fed up with antibiotics, and then they will comes to you. You are also starting antibiotics means definitely they are not taking. It's better being a like Ayurvedic physician. You should go with the Ayurvedic management. So Tamakashwasa, it is a pranavaha Shotodishti Vikara, and it is mainly there is a visheshan of Kapha dosha due to because of Kaphatara Ahara Vihara. It will obstruct the Vata path of Vata, and finally that vitiated Vata will be upward, matlab moving upward, and finally produce the symptoms. So bronchial asthma, it is the chronic inflammatory disease of the respiratory tract. Due to infection, the respiratory tract become narrowing and produce like symptoms cold, cough with the sputum, and difficulty in breathing. Okay, on both matlab, on examination wheezing will be present. Okay, so this is the one case. So in that condition I have started like Ayurvedic treatment, that is tablet Amrita Bhumi, off tablet BD, Brazol syrup 5 ml TID, Brazol nasal solution for a nasal blockage, and Lakshmi Vilasa Rasa half tablet with honey. So for a 1 week. So these four medicines I have advised for 1 week. Once the symptoms come down, then I have like advised Vasagrita. In Vasagrita, I added Abrata Basma 2.5 gram. So along with that, Sitofaladi Chuna, Talisadi Chuna, Haritra Kanda Chuna, I mixed in one container. So everything that mixture of a teaspoon, along with that grita half teaspoon BD and honey. So these three, matlab five content by mixing I advised for 45 days, and later Soamla compound, which is the main Amalaki is the main content of Soamla compound. So Dudh Papeshwara company, that to main intention is to improve the immunity power in the child. So 45 days for those tunas and all. And for 3 months I advise Swamla compound. After 3 months the child improve most of the symptoms like cold, cough, fever come reduce due to because of like Mahalakshmi Vilasarasa, Brazil syrup. Those are anti-inflammatory action. And even though improve recurrent cold cough come down as whatever medicine I advise, that will be improve the immunity power in the child. And the child free from all the symptoms, now no complaints since a year. Okay, previously they used to admit in the hospital with every 15 days they used to take antibiotics. Now they are free from antibiotics, and they are, even though they are free from all the symptoms. Okay. Next, come to the Tundikeri. So, as we know, Tundikeri, it is a Kantaraka Rogas. Here, mainly dosha is Kapha and Rakta dosha along with the Mamsa Dushti. So, Tundikeri, like disease which resembles like as a Karpasa, that is cotton seed. So, tonsillitis, that is inflammation of tonsils caused by bacterial or viral infection. Symptoms like a sore throat, difficulty in swallowing, like fever, myalgia are the main symptoms. Here, one case, that is 6-year-old Vinayak has brought by their parents as they are bothering about that child is getting recurrent fever, cold, cough, throat pain since 3 years. When they consult to the local doctor, they advised like a surgery, but parents are not willing to go for surgery. They came to Ayurvedic management. Then I have started Mahalakshmi Vilasaras with gold half tablet BD with honey, and along with Kanchanara Gugulu, 1 tablet BD with lukewarm water, and Gamusha with Triphala Quata. All the medicines are anti-inflammatory, antimicrobial, antibacterial tablets. And even though that is Kanchanara Gugulu, so that is Kafo Meghahara. This I have started for 1 week, and in second visit, I started supplying syrup, Lakshmi Vilasa Rasa, and Somla compound half tablet with milk in empty stomach for 40 days. So then what happened? Child was free from above problems by first 1 week. Later, what I have maintained for 40 days treatment by that time, but our treatment has been continued for 40 days. Then all the symptoms come reduced, and since 2 year child had no tonsillitis, and even though they are not worrying about surgery and all. Okay, next, Vipadika. Vipadika, this is also one of the Shudra Kushta Roga. It involves predominantly Vata and Kapha dosha, Vaipadikam, Pani Pada Sputanam, Tivra Vedanam. Here symptoms will be like a cracking and bleeding from soles, and Tivra Vedana, severe itching. The 6-year-old boy was brought by their parents. They are bothering about like cracks on heel and feet and severe itching since 1 year, and associated with the bleeding, difficulty in walking since 8 months. They have also consulted local doctor, and they are taken steroids, ointment and all. Patient not found satisfied result. Then they came to our Ayurveda management. So by that time I advise Trifala Kwata for Prakshalana, followed by Mahatikta Grita for external application, and Arogyavardhini Vati and Sand Pure syrup, which is help for purification of Rakta dosha, because here Rakta dosha also involved, and like Aragodadi Kashaya, because in all the skin diseases we need to go for Nitya Virechana. But here classically Virechana is contraindicated for children, but instead of that we can go for Aragvadadi Kashaya. It is a Mrudu Rechana, 5 ml with equal quantity of water BD for 28 days. And by that time a little bit symptoms were come down, but in second visit still I continued Manibhadra Guda. It contained ingredient like as a Trivrut is there. So that is also act as a like Mrudu Virechaka. That 1 teaspoon with hot water at night time. It is a granule form, and Gandhakarasa and half tablet BD and 777 oil. That is for advice external application for next 1 month. So by that time all the cracking and bleeding come down, and even though there is no itching now, no any fresh complaints, symptoms were reduced, patients happy with our treatment, patient got complete relief at present. And still I ask them to continue the same treatment like Shamanaushadha, Gandhakara Sarana, Manibhadra Guda, 777 oil. Is still child is like taking the matlab, under treatment. So one more, that is Vataja Unmada. So Unmada, uh, that is we can compare with the ADHD in Ayurveda. So in modern attention deficit hyperactivity disorder. Here mainly dosha is Vata dosha will be involved. It is most common neurodevelopmental disorder. So this will be sometime what happened, matruja ahara vihara play an important role during antenatal period. So if she will consume more vatakara ahara vihara, maybe leads to vataja unmada after birth. So ADHD, it is a neurological neurodevelopmental disorder characterized by impairing of impulsivity and hyperactivity is the main symptoms. In sub symptoms also, like child is not able to sitting for longer period in a one place, and child is easily distracted, and child is not complete his homework completely. Look, see, these are the symptoms. On the basis of symptoms, we are diagnosed whether it is impulsive ADHD or inattentive ADHD or combination of ADHD. On the basis of if symptoms will be present more than six for a period of more than 6 months, then we are diagnosing through DSM 5 criteria, diagnostic and manual criteria 5. Mm, Through that we are diagnosing. This is my I have received a faculty grant from BLD University, so this is under study. So for this I have only one group, 20 patient I am selecting. Takradara processed with the media drugs, that is Vacha, Jatamansi, Ashwagandha and Brahmi, making like a Vata, and mix with the Takra, that we are advising here a Takradara for 7 days, and followed by Talam with the Rasna Churna. And after 7 days, 7th day onwards, we are starting Brahmi Grita for 83 days, continuously for 83 days. Brahmi Grita is advising. So totally 3 month treatment it is. So after 3 months, most of the symptoms like hyperactivity, impulsivity, inattentions were reduced. Reduced means some improvement was there, and now parents telling as their child is sitting for 30 to 45 minutes in a one place for longer, and even the child is focusing in things and the completing his homework with a little force. Okay, so this is the improvement after 3 months of treatment, that is Takradara processed with the media drugs like Vacha, Jatamamsi, Ashwagandha and Brahmi. And uh, after that they came with me, madam, now my child is improvement is there, we need the same treatment, but that treatment duration is only 3 months. I have started shirodhara with brahmi taila and kshirabala taila for 8 days, and shiropichu with brahmi taila at evening, and nasse with ashwagandha grita for 8 days. So along with Shodhana, I have started Kalyanaka Grita with the honey half teaspoon BD, Saraswatarista 5 ml TID, Brahmi Vati with the gold half tablet BD. So most of the medicines which I have like advising, we are selecting those should be that improve the act as a nootropic action, even though it will protect the neuron, and it calms the mind, it calms the mind, and it improve the focus to the child. A result, finally child day by day focusing in study, completing his homework properly, and even the parents also feeling very happy. Now child is sitting for a longer means up to 30 to 45 minutes At least child is sitting in school, in even though home and all, then he's only doing his homework. So this is the improvement. So next come to the Sarvanga Vata, that is cerebral palsy. Once they allopathic doctors fails for this disease, they definitely approach to Ayurvedic physician. So this is the main cause is, we know this is due to because of birth asphyxia. Child should be cried immediately after birth. If not cried, so oxygen will be not supplied to the brain. That leads to that cause hypoxia, and finally multi organ dysfunction will be happen, and finally HIE, hypoxic ischemic encephalopathy will be happen. Finally neuromuscular sequelae will be end up with child with neuromuscular sequelae. So here in that cerebral palsy, due to because of birth asphyxia, so here one case, that is 13-year-old child, that is child is not able to stand, walk without support till to this age. Only she can able to sit, but not stand and walk without support. With support she will be stand and walk, and only speaks bisyllables, and history of delay milestone all, like neck holding, proning, everything is delayed. And her birth history is full time normal vaginal delivery, but not cried after birth. Admitted in NSC for 8 days due to birth asphyxia, and underwent many allopathic treatment, physiotherapy, and all. So they were telling like, we are not that much result, madam. So many are telling Ayurveda is good for this kind of treatment, matlab disease. I to explain same thing. Here also we are not like treatment. We can improve the quality of life, and we can manage the milestones can improve. So that I have told. And on examination, drooling of saliva, spasticity were present, and microcephaly was there. Deep tendon reflexes were exaggerated. So these are the complaints of that child. So I have started firstly Udvartana to remove the kapha vrita. To remove the kapha, I started Udvartana for 3 days along with the Matravasti with the Mahanarana Taila. So after that, after 3 day of treatment Udvartana, later I started Aragya matlab Abhyanga with the Mahanarana Taila and Shastikshale Pinda Sweda. So all the Vatahara Tailas we need to take along with the Bali and Brahmana drugs, and along with Shamana Chikitsa like Brahmi Batti 1 tablet BD, Kalyanaka Gritha half teaspoon BD, and Vacha Churna, ST Churna, Jatamansi Churna. You just mix all three and advise 4 pinch BD with honey for 45 days. So after 1.5 month treatment, again they came to me. That time again I started Sarvabhyanga with the Kshiravala Taila and Nadi Sveda, and that time I started Yoga Vasti. So Yoga Vasti, Anvasana, and followed by Yoga, Anvasana Yoga. Lastly, like 2 days Anvasana Vasti. So first Anvasana with the Kshiravala Taila, and Kashavasti with the Mustadi Yapana. So here Mustadi, it is a like a rasayana nature, and even though it will be act as a brahmana and a balya, okay, anvas like honey, 15 ml, salt 5 gram, Shirabala Taila, and Dashamula Churna, like Mustadi Kashaya for a Kashaya Vasti. So this I have given for 8 days. So after that, along with the Shodhana, I have started Shamana Chikitsa also. Tablet Brahmi Bhatti with gourd, 1 tablet BD, Mahakalyanaka Grita, 1 TSP BD, and same Vachachuna ST and all. Matlab 4 pinch for 2 times with the honey. So Balashodhana Taila for external application at home. So this is the second time when they came to for treatment. This is the I advised. The improvement was like a, now child is trying to stand and walk without support. Now trying child is trying to stand and walk without support, and the child is speak 1 to 2 words, 2 word sentence, and tone of the muzzle improved, and rolling of saliva reduced. So as here also same Vacha, ST, these all are nootropic drugs which will improve the neuron like neuroprotective action, and ST anxiolytic and memory enhancing effect. So Brahmi, it is an antidepressant uh, property. So by this it will be calm the baby. And even though most of the Mahakalyanika Grutta, it is a Vata Shamaka property. So by this it will improve the tone of the muscle. Okay, so if a child is Karsha or hypotonic, you can select Kshirabala Taila. If spasticity is more, then go for Prasarani Taila. If obesity or Vata Kapha association, then Dhanvantari Taila can select. So Balashwagandha Taila can be used for Balya and Brahmana aspect. So next one more, that is Ardita Vata. Ardita means half of the phase will be involving here due to because of vitiation of Vata. So here seventh nerve is involving, that is seventh nerve is facial nerve. If child exposed to any Vatakara Ahara Vihara, so facial nerve become inflamed and produce the symptoms. So here 6 year old female child was brought by their parents to our OPD with the complaining of deviation of mouth towards normal side, improper closure of eye, lacrimation from affected side with other symptoms since 4 days. So since 4 days, actually they have consulted local doctor. They have taken medicine, but not fully satisfied with their treatment. They came to me after 45 days of treatment. Most of the symptoms were come down. There is a no deviation, and even the child is able to speak properly, closing of eye and all improved. So this is the like improvement. The treatment like a Shiromukha Abhyanga with Kshiravalathela for 7 days, followed by Kukutanda Pindasveda and Navananasya with Anutaila, 4 drop on each nostril for 7 days, and for 1 week I have advised. And after that Shamanaushadis like Brahatvata Chintamani Rasa, with that Kalyanaka Grita half teaspoon BD, and with Madhu half teaspoon BD, along with Bala Mashavikwata 5 ml with equal quantity of water before food, and estimado fonta, estimado fonta as a eye drop, because there is a improper closure is there, eye is there. So that will be cause inflammation of eye. So here estimado fonta will reduce the inflammation. So this I advise for 45 days. So you can see the most of the symptoms were come down. So next Apa Smara. Apa means loss. Smara means like memory. Here there is a loss of smriti by Tama Pravesha. So epilepsy, it is a chronic neurological disorder characterized by recurrent seizure caused by abnormal electrical activity in the brain that leads to change in the muscle control, change in emotions and behavior. So 16-year-old boy brought by their parents with the complaining of 1 to 2 episodes of conversions twice in a week. The loss of conscious for 2 to 3 minutes, drowsiness up to half an hour, tongue bite, and bite marks over body parts, and even the poor memory, poor communications were there during examination. So above symptoms present since 8 years with the normal birth history, and even the child is on like anti-epileptic drug. So I have not stopped the anti-epileptic drug. Along with those medicine, I have started our treatment like Shirodhara with Brahmi Taila and with Kshirabala Taila for 8 days. Matra Basti with the Brahmi Vrita. In that 2 pinch Jetamansi and 1 pinch Saindava I have added and advised Matra Basti for 8 days. So Shiropichu with the Brahmi Taila at evening. along with the Shodhana and Shamana, Brahmivati with gold one time, Smriti Sagar Rasa one time, and Tantupashana, it is a anti-epileptic drug, and Panchagavya Gritha 1 TSP with the milk. This I advise for 1 month. Again, they little improvement. They came to for a follow up. The second time started cognium syrup, that is charaka form, 5 ml BD, TID, and tablet Manasamitravati 1 tablet BD, Vacha Churna, Jatamamsi Churna 4 pinch with honey, and tablet Tantupashanavati 1 tablet BD, and along with that Anutaila Nasya 2 to drop on each nostril for 45 days. So now the improvement like episodes of conversions come reduced, and improve in his memory, improve speech and communication skill with the teacher, and in study also he's improved. So this is the improvement of Shirodhara for Apasmara. Next, GDD, Global Developmental Disorder. So, child, so this we can assess by four domains, that is gross motor, fine motor, key social, and key language. If an impaired more than two or more than two domains, then we will diagnose it as a global developmental delay. So here main history is delayed milestone will be present. So 1.8-year-old female child unable to walk without support till to this age, but here birth history will be normal. Only speaks bisyllables, conscious alert, but poor social and communication skill. So on the symptoms, I diagnosed it is a global developmental delay. Mm, treatment like a Sarvabhyanga with the Bala Ashwagandha Taila for 8 days, Shastika Shali Pindasveda for 8 days, Matravasti with the Kshirabala Taila for 8 days. 20 ml I have given. Along with that, Shamana Chikitsa like a Saraswatarista, Kalyanaka Krita with the honey, and Vacha Churna, Jatamamsi Churna, 2 pinch with the honey, and tablet Brahmivati, half tablet Bedi for a 42 days. So improvement like a now child try to walking without support, and even they improve clarity in speech. It and even the child is interact or playing with her siblings. So one more, that is Karsia or a underweight. So 6-year-old child not gaining weight since months. It means child weight is less than 80%. So associated with the loss of appetite and loss of taste, and a generalized weakness, history of constipation, sometimes history of loose stool. So thin built, she is very thin, and her weight is 16.3 kg. So her weight is expected less than 80%. That's why it is diagnosed as a Karshia. So because of she has loss of appetite, for that I have started Trikatu Chuna, half teaspoon BD with hot water before food for 5 days, tablet Krimi Kutar Rasa, as she is complaining like a sometime loose stool, sometime like constipation, loss of appetite. These all are the symptoms of like a krimi. So that's why I started Krimi Kutarvasa, one tablet for 7 days. Tablet Nutrimed. It is a Univa Medica company tablet. Its main content is ashwagandha. It helps to like improve the weight of the child. One tablet BD. Balamashadi Fuata. It is a Balya Brahmana. 5 ml with equal quantity of water before or after food. You can advise for 10 days. So along with that, the child came with the parents telling like my child is little bit improve the appetite and all. Madam, like, you can start panchakarma. As I started in starting only, I told for this matravasti and all gives good result, but they told now you can advise only shamanaushadi. Now they came for a shodhana, like that is panchakarma. That time I have started sarvabhyanga with the balashwa gandha taila for 8 days, shashtikshali pindasveda, matravasti with ashwagandha gritha for 8 days, along with Shamanaushadi, Madhifala Rasayana, and tablet Nutrimed, and Balamashari Kwata for 1 month. So, totally child, like after 1 week of treatment, only appetite were improved. Now, child is significantly gaining weight. Her now present weight is 17.9 kg. No tiredness after playing. She's become very active and playing with friends and all. So this actually the Karshia, this is one more faculty grant which I have received from RGHS in the year of 2023. So totally 100 patients, 100 childrens, and 50 in each group. For one first group, I am advising Yavadi Chuna and Vidari Kandadi Chuna for B group. So so do in compared to Vidari Kandadi Chuna, Yavadi Chuna giving good result, as Yavadi Chuna contains like a Bala, Ashwagandha, Masha, Guda, Tila and all. Most of the drugs which I have selected in Yavadi, those are Balya, Brahmana, even though it will be improve the appetite. So this is my one more study. Uh, Next, irritable bowel syndrome. So, 3-year-old child brought their parents with complaining of loose stools with mucus and blood with frequency of like 50 to 20 times per day. Child will be passing immediately after food. Since year, child is taking the treatment in a allopathic hospital. When they will admitted for 8 to 10 days, that time the symptoms will be come down. Once they stop the treatment again, child will be passing the stool. So associated with the poor appetite and loss of taste, these were the complaints. They fed up with the allopathic treatment, they came to ayurvedic. So by that I have started Madhifala Rasayana 5 ml with equal quantity of water before food, and a Mebarid tablet with Takra, uh, 1 tablet BD, Vilvadi Leha, half teaspoon with hot water after food, and Panchamrita Parpati, half tablet BD with Takra. Uh, so in first 15 days, only Madhifala Rasana, Mabarid tablet and Vilvadi Leha and advised. After 15 days, started Kutajarista, Takrarista and stop IBS tablet. It was totally 1 month treatment I advised. Later they came with little improvement, like a frequency of loose stool come down. So previously 15 to 20 days child is going for toilet. Now 10 to 12 days, but 10 to 12 times per day. But still little improvement. Then I started Sarvabhyanga with Kshirabala Taila, Nadi Sweda. The main is Takrabasti will give good result in irritable bowel syndrome. So, yeah, Anuvasana Vasti with the Changiri Grita 25 ml, followed by Takravasti. Takravasti honey 15 ml, Lavana 2 to 3 grams, Changiri Grita 25 ml, Shatapushpa Chuna Kalka 5 gram, Takra 15 ml. So, totally 100 to 120 ml can give as a Takravasti, and along with that oral medicines Takrarista tablet, stop IBS and Vilvadi Leha for next 15 for next 40 days. So later most all the frequency of stool come down. Only 3 to 4 times child is going for toilet, even though his appetite also improved, and he's gaining weight also. Okay, next Shaya Mudra, bed wetting. So this is a Kaphavruta Vata, mainly Apana Vata will be involving. Up to 5 year, 15 to 20% is a commonly child will be passing urine at night time unknowingly, and up to 12 year, 80% in male, for 4% in female. So boys are more prone to female, as female attains milestones early compared to boys. So here 13-year-old female child complaining of passing urine in a wrong place in a wrong time unknowingly for a significant period of 1 year. Since 1 year she is passing, and I started tablet Neo, one tablet BD, and Balarista 5 ml with equal quantity of water BD after food, and Vermicid syrup 5 ml BD, and a Chandra Prabhavati 1 tablet BD, tablet Brahmin 1 tablet BD for a 45 days. Along with, we need to counsel the child as well as parents. We need to take the history whether child is like any fear or any psychological disturbance. So that history we need to take from parents. So advise alarm therapy, and every 4 hourly child should be pass the urine by putting alarm, and avoid the liquid items after 6 p.m. So after 6 p.m. child should not take any kind of liquid, like tea, coffee, cold drinks and all should be avoided after 6 p.m. And even though we very important to to train bladder training, ask to child hold the urine for a longer period to improve the controlling capacity of bladder. So this is the management. So here Balarista and all, Balli and Rumana, which will be strengthened to the bladder, and in tablet Neo, this main ingredient is Kapikachu, which helps the calm the nerve impulse and improve the stamina and strengthen to the bladder. So here Chandraprabha Vati, it improves the bladder tone, and in reduce it is polyuria and urgency. So as it is a herbo mineral which will give good result in a Shaya Mutra. So most of the drug we are selecting here to improve the cognitive function, and anti-stress and anxiolytic property medicine should be taken. So after our this treatment, the frequency of urine and all come down, and even though child is alternative days or once in a or twice in a week child is passing the urine. So gradually, if you are continue the treatment, gradually the symptoms will be come down. So along with that, you can add Brahmi Churna, Shankapushpi Churna, Vangagasma also you can advise. And so sometime what happen, due to because of krimi also cause to irritate the bladder and the child, induce for a bedwetting. So in that condition, you should advise Krimikitar Rasa, and sometimes constipation also cause for a bedwetting. So just clear the constipation with Avipatikara Churna. If not possible to manage with oral medication, you can go for even though Matra Vasti also with Balashwagandha Taila or any Kshira Bala Taila. Okay, so however, in modern peoples will advise antidiuretic tablet, that is like desmopressin, which is not a permanent solution. So we can manage through Ayurveda. So next, DMD, Duchenne muscular dystrophy. So DMD, it is a genetic disorder which affects the body due to mutation in the dystrophin gene on X chromosome. So here it, as it is a X-linked recessive disorder. So here females always carrier, male will get affect. It is characterized by progressive symmetrical muscular weakness, with the proximal muscular muscles will being more affected than distal. So the symptoms will be start onset is 3 to 6 year. Gradually the weakness, muscle weakness will be present. So by the age of 10 to 12 year, child will be depends on wheelchair. And so as the child is growing, finally the muscles will become weakening, and the child end up with the death, as it is a genetic disorder. Even though modern peoples are Ayurveda treatment also not treating this disease, but through Ayurveda or by doing Panchakarma, we can improve the quality of life and improve the contractions of a child. And here, in this condition, child will be difficult in walking, unable to climbing the stairs, and frequently falling while walking. In this condition, not birth history will be normal. In on examination, child will be walk with the help of toe and goer sign positive. That is, child is standing with matlab with the help of palms keeping over floor and over knee joint, then he will stand. That is, goer sign will be positive, and zero hypertrophy of calves. Matlab in calf muscles become like enlarged, but these are the not true muscles. These are the pseudo hypertrophy of calves. These are the main clinical features. So in however in the condition we can't treat, we can manage. So management. So Sarvabhyanga with Kshiravala Taila, Shastikashala Pindasveda, these all are Vata Shamaka and Balya Brahmana. So it will be somewhat improve the it give the somewhat strength to the child. And Yoga Vasti, I have planned Anuvasan with Bala Taila and Kashavasti with the Bala and Dashmula Kwata. So honey, salt, Bala Taila, Shatapushpa Kalka, and Bala and Dashamula Kwata prepared for a Kashaya Vasti. So this I have advised for a 1 week. Along with that, Balarishta, Ashwagandha Alista, Bala Ashwagandha Taila also you can advise for local application, and Saraswatarista and Balya Brahmana Chikitsa will be giving more effect in a effect means it will improve the quality of life. So before starting your treatment, you should counsel to the parents, as a this is a genetic disease. If you are giving male child birth, definitely child will affect with this condition and child will be die. So counseling is very important. In during antenatal period only, you need to like find sex determination. If it is a male, but matlab advice to terminate that pregnancy. If female, advice to continue the pregnancy. Last, that is Pakshagata, hemiplegia. So 9-year-old child brought with history of right hemiplegia. Previous history was like a child was asymptomatic before 8 days. While walking, while going to the school, child got accident. So that time, loss of conscious with the bleeding from ear and nose and severe head injury were present, and even the higher motor functions are impaired. Immediately, their parents are shifted to the hospital and admitted at ICU for 8 days and treated accordingly. After 10 days, they have got discharged, but not fully improvement. Only child become conscious and all. Now present history like a child falling while walking and abnormal speech. On examination, child is conscious but not well oriented to time, place, person, and there is a slurred speech and hemiplegic gait were present and unable to stand walk properly. So this is the main complaints of this disease. So I have started Udvartana, mm, Udvartana with the Udvartana Chuna for 3 days. So Basti, Yoga Basti, Anvasana with the Dhanvantari Taila, and Kashavasti with the Kashavasti with the Mustadi Yapana Basti. So in Dhanvantari Taila, I added Saindava Lavana 1 gram, Shatapushpa Chuna 2 gram for Anvasana Vasti, and along with the Sarvabhyanga and Nadi Sudha for 5 days. Kashavasti, Mustadi Yapanavasti, honey, salt, Dhanvantari Taila, Shatapushpa Churna, Mustadi Churna Kwata, total 120 ml, and Shirodhara with coconut oil and Brahmi Taila for 8 days, Shiropichu with Brahmi at evening for 8 days. So totally for 8 days, I have advised this Udvartana Sarvabhyanga Nadisveda Yoga Vasti Shirodhara and Shiropichu. After that, while discharging, advise pulsing neuron tablet, half tablet BD after food, and Balarista 5 ml with equal quantity of water after food BD. Gandharvastadi Taila half teaspoon with hot water at bedtime. Shilajatu Vati half tablet BD after food, and Dhanadhanayanadi Kashaya 5 ml with equal quantity of water before food 2 times. Balashwagandha Taila external application to Vacha Chuna, Pipli Chuna, ST 2 pinch with honey for 45 days. So after 1 2 month of treatment, child improve his walking and gait, and improve in his speech, improve in his memory power. Now parents and child both are happy with improvement. Still, we are like child is under treatment, but still we will have a little improvement with walking, gait, speech, and memory power. So lastly, PCOD almost like nowadays, or out of 10 female matlab female, 1 to 2 will be suffering with the PCOD due to because of like mm, intake of junk food, like sedentary life, impairment of digestive power or metabolism, and sometimes they are not following proper diet and lifestyle modification. So it is raso medo dhatu vikara. So here we are prescribing like amapachaka dravyas, vata kapha hara dravyas. Sometimes we are going for shodhana, like virechana also we can advise. So the main symptoms will be like irregular menses, and mood swinging, okay, weight gaining. So these are the common symptoms we can see in a girls. So in that time, we to induce the menses, we are going for Rajapravartimati 1 tablet uh, TID after food, followed by Varunadi Kashaya, Kanchanara Guggulu. As a Varunadi Kashaya and Kanchanara Guggulu, it is a Medo Kafahara property, and Staulihara Kasha also we can advise 10 ml with equal quantity of water before food for 2 times. Even the Triphala Gugulu also very good result, and Saraswatarista as they will be having more mood swings, so we can go for Saraswatarista. So one more, that is Shatavari Gulam. It is single drug is enough to cure PCOD in a acute condition. As a Shatavari, it is a Rasayana, and even though it will be balance the hormone hormones, and even though it induce the menses in case of irregular menses. So it should give 1 tsp with hot milk at bedtime for continuously 1 month. So definitely next coming cycle will become normal. So this is the management for PCOD. So some frequently I used to prescribing some medicines in my clinic for respiratory system, Brazil syrup tablet, or syrup, or Brazil nasal drop for blockage of nasal, and a peak of syrup, and Talisadi Chuna, Sitopaladi Chuna, Lakshmi Vilasa Rasa, Haridrakanda, Naradi Lakshmi Vilasa Rasa, Mahalakshmi Vilasa Rasa, Abrakabhasma. These are the some list of the medicine which I am prescribing for respiratory system, and In case of GIT system, I used to prescribe Mabarid tablet or syrup, Madhifala Rasayana, Shankavati, Panchamrita Parpati, Avipatikara Chuna, Krikatu Chuna and all. In case of skin diseases, Aragavardhanuti, Gandhakarasana, Trifalakwata Chuna, Trifala Chuna and Trifalakwata for Prakshalana, Tamravasma, Panchatikta, Drita Gugulu capsule, and Maricha Taila. So these are the list of medicines for skin diseases. And in case of Manasika Roga or like for a media, if in case of low IQ, if child is not concentrating, if not studying properly, can go for a Brahmi Vati, Smriti Sagarasa, Cognum syrup, Brahmi Grita, and Saraswatarishta, Vacha Churna, Panchagavya Grita, Maha, Paishachaka Gurta, and Sumana tablet. So these are the some medicines. And neurological disorders, Balarista, Ashwagandharista, and Palsinura, Brihatvata Chintamani Rasa, Kshirabala Taila, Balashwagandha Taila, Shilajatuvati, Shivabutika also can advise. So this is about today's session. Thank you so much. Thank you, organizing committee. Thank you, alumni, DGM Alumni Association. I'm so grateful for